Patricia E. was an ophthalmologist and laser scientist who invented a device and technique that allowed her to use lasers to remove cataracts. Dr. Bath also created a new discipline called community ophthalmology. This is an approach to eye health care and blindness prevention that combines public health initiatives, community medicine, and ophthalmology. A couple of events in Dr. Bath's childhood inspired her to become a doctor when she was a child. Hearing about a doctor's service to lepers in the Congo, and a chemistry set given to Dr. Bath by her mother. Growing up, like many African American women, Dr. Bath faced obstacles related to her skin color and gender. Sexism, racism, and relative poverty were the obstacles which I faced as a young girl growing up in Harlem. There were no women physicians I knew of and surgery was a male-dominated profession. No high schools existed in Harlem, a predominantly black community. As an adult she continued to encounter the same obstacles. She overcame many instances of racism and sexism, however, in her case that meant moving to Europe and England to continue research she was doing in the United States. She had been working at UCLA but moved abroad to avoid the glass ceilings. Dr. Bath worked and continued researching technology and medical procedures at the Laser Medical Center of Berlin, the Rothschild Eye Institute of Paris, and the Loughborough Institute of Technology in England. They accepted her research, which was ahead of its time in the sense that the technology had not yet been invented. She talks about her initial experiences working as the only African American and only female many times in a Times interview. In 1988, Dr. Bath received a patent for the laser phaco probe, which allowed a non-invasive way to treat cataracts using lasers. Prior to the probe, cataract surgery was painful, took a long amount of time, and was expensive. The old way of doing it included grinding down the lens of an eye until the cataracts were almost gone. The laser technique Dr. Bath created made that unnecessary. Her new technique involved using lasers, suction, and irrigation to remove the hardened, cloudy eye lens and replacing it with an artificial, long-lasting one. Her technique restored sight to people who had been blind almost 30 years. It is still in use worldwide today.